Howdy, y'all. This is Paul, the Redneck Thinker. What we have here is a channel to communicate. I want you folks to be thinking by the time you leave my videos. Why? Because I'm tired of people talking via what other people tell them to think. So, watch my video and enjoy the chance to think for yourself. Oh, and if you don't mind, like, subscribe, comment. And I've got a link tree down below. It's got my social media. And it has my Patreon if you want to help out. Thank y'all. There are no words to describe what goes through the minds of military veterans some days. Many have seen the horrors that no person should, while others dealt with situations that caused them to become intimate with death. It would be nice if the agency created to help veterans would, but the Department of Veterans Affairs does nothing but fail. Could this be the reason so many of us are against government controlling health care? So, this video and article, because this is also going to be on Substack, so you can reference what I'm talking about, we'll cover the most recent findings on how badly the VA is failing, which is leading to veterans suffering with mental issues even after asking for help. There comes a point that people need to quit pushing that we need to pay billions for other nations and criminal immigrants, as veterans and American children are being failed by these policies. American citizens need to speak up more. Yeah, basically, it's a bunch of bullshit that we have allowed everybody else to have all kinds of benefits, including the government unions that are... The main reason the VA is failing is because of the dipshits that all are members of the government unions, and they're helping make it worse for veterans. Get them out. Have the people that should actually be taking care of veterans be taking care of veterans. But let's get into these two reports. Okay, well, not actually one of the two reports. Here's something fascinating that was written by the NIH. And I want you to listen, because I read it and I went, holy cow, they're right for once. Okay, the United States has become a country that is constantly at war. This situation has created a crisis amongst our veterans. The current uneven access to appropriate mental health services that returning U.S. veterans encounter echoes the disparities in access to quality health services for the general population. The information presented here shows the shortcomings of our healthcare system is addressing the mental health needs for our returning veterans may lead to the high suicide rates. Addressing the problems of inadequate access to quality mental health services is critical in any effort reforming the U.S. healthcare system. Our findings suggest that mental health disparities are often a leading factor to the high suicide rates among veterans who experience depression and post-traumatic stress disorder. To improve the health of those who to improve the health and well-being of our veterans who have served this nation requires a collaboration between public and nonprofit mental health providers at the state and local levels. It is imperative that we increase the availability of crisis intervention and mental health services for all veterans that have served this nation. Many recent reports have identified that individuals enlist for many reasons, often due to patriotism, educational benefits, family tradition, military service, and financial inducements. This may help explain why young adults in the armed forces, many youth, often believe that they are invincible, and one never thinks that they could get killed or seriously injured in a combat zone. Many recruits are high school graduates with limited job prospects, and the military seems like a place to get a job and learn some skills. The reality is markedly different. Our soldiers today fight wars unlike any others who have fought. They fight a largely unseen enemy and face casualties from IEDs and suicide bombers. Many are injured and maimed by unseen foes. They fight for unclear objectives and end up coming home with limited skills and in many cases with severe physical and mental injuries. They are often separated from military service with questionable employment prospects. A number of veterans experience depression, loss of purpose, present in some cases an overwhelming family crisis. Their mental health difficulties profoundly touch the lives of the U.S. general public. Recent reports documents that military personnel have experienced conditions that have affected their mental well-being. Their efforts to gain access to quality psychological health services after multiple deployments are often met with significant obstacles. This lack of access to critical mental health services may lead to suicidal behavior, especially among young military veterans who have completed multiple deployments to Afghanistan and Iraq. Recent data on suicide rates among Army veterans reported by the Department of Defense shows an increase of more than 18% from 2011 to 2014. The Department of Veterans Affairs is now struggling to find solutions to this national crisis for our veterans. The rate of suicidal deaths is considerably higher in veteran populations. For example, the rate of suicides among women veterans is 35 per 100,000, a rate that is much higher than their civilian counterparts. Suicide in civilian populations is addressed, for example, by community-based mental health treatment providers such as Baltimore Crisis Response Incorporated, which serves the greater Baltimore region through a crisis response hotline. Mobile crisis response teams of mental health and substance abuse treatment beds for inpatient treatment services. These and similar suicide prevention programs have proven to be successful in lowering suicide rates for the civilian population in urban communities such as Baltimore and Boston. Okay, this first report that I'm going to be talking about is from ProPublica. They are a left-leaning organization, but they did a really good report here. Okay, and this is part of the report. That conclusion emerges from a ProPublica review of all of the reports published by the VA Inspector General since 2020 that includes 162 regular surveys of facilities and 151 investigations that were triggered by a complaint or call to the office on a wide variety of alleged healthcare problems. Issues with mental health care surfaced in half the routine inspections. Employees botched screenings meant to assess veterans' risk of suicide or violence. Sometimes they performed the screenings, sometimes they didn't perform the screenings at all. They missed mandatory mental health training programs and failed to follow up with patients as required by VA protocol. 1 in 4 of the reports stemming from calls or complaints detailed similar breakdowns. In the most extreme cases, facilities lost track of veterans or failed to prevent suicides under their own roof. 16 veterans who received substandard care killed themselves or other people, the review revealed. In addition, additional 5 died of reasons related to poor care, such as bad drug interaction, with the reports say could have been prevented. 21 such deaths is a meaningful count even for a healthcare system that has more than 9 million people enrolled, in the view of Charles Bigley, a Tulane University professor, an expert in military mental health. The VA has struggled with mental health cares for decades. It's a national disgrace. For grieving family members, it's incomprehensible. It was never my expectation that the VA was going to solve his problem, said Colin Dermick, the son of a veteran in Pittsburgh. My expectations were that someone who was saying, "Help me," would receive some kind of help. The Inspector General report reviewed by ProPublica have limitations. The individual investigations can be narrow. The reports offer only broad suggestions as to whether individuals should be held accountable for breakdowns and provide little sense of whether they actually were. Even together, they don't capture the reality of the VA's 1,300 medical care facilities, but they do start to assemble a meaningful picture of the system's most chronic shortcomings when it comes to treating people with mental illness. Experts told ProPublica the failures revealed in the Inspector General reports point to broad problems, including inadequate mental health staffing, outdated policies, and the inability to enforce high standards across a large decentralized healthcare network. It's a very sad thing, said M. David Rudd, a psychology professor at the University of Memphis, for whom the Rudd Institute for Veteran and Military Suicide Prevention is named. You can sit here today and predict with great accuracy how many deaths there are going to be over the next 5 years. Yet, there are unlikely to be any meaningful, significant changes. Okay, and this report comes from the now left-leaning military.com. They used to be somewhat common sense based, but now they're getting more and more liberal. And yes, I did just infer that being liberal is not based in common sense. The Department of Veteran Affairs actively encourages veterans to enroll in VA healthcare, and officials, including VA Secretary Dennis McDonough, voiced pride in the department's expertise treating combat-related mental health conditions. And in 2023 alone, nearly 11% of the nation's 18.1 million veterans sought mental health services at the VA, having 19.6 million behavioral health encounters with the VA, including appointments, walk-ins, and emergency room visits. But veterans say they cannot get individual therapy appointments to accompany psychiatric medical care. And when they do connect, the treatment is often derailed by appointment cancellations and scheduling problems, according to more than a dozen veterans and current and former VA employees interviewed by military.com. They shared remarkably similar stories of working up the courage to seek help, something that historically has not been easy in a community skeptical of mental health treatment, and waiting months for sessions as multiple appointments were canceled either at the start of telehealth session or in their arrival at a medical center or clinic. Sometimes they'd be blamed, accused of failing to show up for appointments they didn't know about, or told they'd canceled the appointments themselves. In the past 18 months, a former Army sergeant seeking mental health treatment at the VA Puget Sound Health System has had 7 of 16 behavioral health appointments canceled, according to reports provided by his mother to military.com. According to the records, former soldiers' appointments were canceled every month from July through November 2023. He keeps trying to go back to school. He is having difficulty. He just wants to know what is wrong, his mom Meredith said. He felt like he was not being taken seriously and is just frustrated by the delay. Data provided by the VA shows that from 2020 through 2023, the cancellation rate for mental health appointments across facilities averaged 10.6%, with the high of 12.1% in 2020, early in the COVID pandemic, to 9.2% in 2023. But individual medical centers may have bigger issues. Data obtained by the Americans for Prosperity Foundation through an ongoing Freedom of Information Act lawsuit showed that 14 representative facilities across the U.S. from January 2020 to the late May 2021, the cancellation rate was nearly double the VA provided figures at 21%, although the time frame coincided with the height of the COVID-19 pandemic restriction on non-urgent care. The foundation funds training, education, and policy research for libertarian and conservative causes, including Concerned Veterans, an affiliated advocacy group that supports broader access for veterans to private health care. Any cancellation, there we go, I can speak, can affect the continuity of care and have a negative impact on a veteran's health. However, they may even contribute to suicide among veterans, although exactly how many is unknown. The number is not zero, however, according to families. They seriously need to do their jobs, basically, is what's being said. Basically, what both these reports and what I read from the NIH gets down to: VA needs to get their job done. They need to get the government unions out of the VA. They need to get the politics out of the VA. And they need to start doing their job. A lot of the VA would be helped by getting rid of people who shouldn't be in the VA. There are far too many administrative jobs that don't do anything, but are protected by the government unions because you got to have the jobs, and the government unions have got to get the fees, because how do you think the Democrat Party is funded? That's why the government unions are where they are. Because it's funding for the Democrat Party. And it's making the VA worse. Not better, worse. My brothers and sisters, and I almost was one of them, commit suicide far too often. We're spoke down to. Yes, people on the streets thank us for our service. Then we have to deal with the VA. We're lied to, we're lied about. We don't feel like we have any options. In a lot of places, almost half the homeless population is veterans. And how much you want to bet that almost every single one of the homeless veterans have mental health issues? Some dumbass the other day made the comment, oh, veterans make that, homeless make that choice. You're only homeless by choice. No, dumbass, you're not. The veterans who are homeless, a lot of them say that they're doing it by choice because they don't want to harm their family and loved ones and friends. But here's the problem. The reason that they're at that point is because dumbasses like that, who think homeless are only homeless by choice. The only reason that these people are on the fucking streets, dumbasses, is because these folks aren't getting any help. I know a feller that went to the VA for a heart condition and came out. They barely helped his heart condition, and he had bed bugs when he came out. I know other people that were on the list to not be seen, but to make it look like they were being seen in Arizona. Our VA system is fucked. And I am tired of having to talk about it, but I am going to keep talking about it until those dumb sons of bitches fix it. And the number one way to fix it is to get rid of the God-blessed unions who are a bunch of worthless jackasses. If you wonder why I have a problem with unions, it's because of what they've done to the VA. If you want me to be on your side, unions, get rid of the motherfuckers in the VA. Now, how many union members are veterans? How many of them have been fucked over because of your need to have political donations go to the Democrat Party? This has been Paul, Redneck Thinker. I'm going to end this before I get any worse. Have a good day. Bye. Folks, I just want to say thank you for listening. I want to thank you for taking your time. I want to hear what your comments are about what you think on this topic, because your comments are what's important, not necessarily mine. I don't care if you're Republican. I don't care if you're conservative. I don't care if you're liberal. I don't care if you're Democrat. I want to hear your opinion on these topics. I want to thank you yet again for listening to my video. Like, subscribe, and all that other hoopla. This has been Paul, the Redneck Thinker. Y'all have a good day now. Bye.